Good morning, everybody. Thanks for being here. We're excited to have you here for the second in our four-part series of my story. It was really had such a warm welcome the last time we did the My Story series, and so we decided we would do it again because there are so many stories to tell in this community. And so we're excited to be part of the second one today. The first one, I treated Ebola patients. And it was really a remarkable story of people who are at work just down the road, just down the interstate in Omaha, taking care of patients from around the world, and how they do that, and how the care of infectious disease has really changed over the years, and what we're doing here in Lincoln to protect ourselves against outbreaks of all kinds. So we were fascinated by that, as I know we will be today. We do have two more planned in our series. One will be about homelessness and talking about folks who are maybe unique in their story of homelessness, parents with children, and how they survive that particular issue in their lives. And then we'll also be talking with folks who have either experienced mental illness or who are caregivers or parents of people with mental illness. And so we're excited to hear their stories as well. All of these take a certain amount of courage and bravery to come here and tell these stories. And I'm constantly amazed that folks are willing to step forward and do that simply for the purpose of educating us and for helping us understand and do better in these circumstances. So thank you all for doing that. So today's program is about a very, very serious topic, suicide. And we've heard a lot about this in recent months in our community, a series of tragic accidents, primarily involving youth. And I know there are a lot of people at work on this topic in our community, but the ones that we can learn the most from are the ones who have experienced it, who have survived the suicide of someone close to them, or who are working with patients and individuals every day. And so that's what we're going to be doing this morning. I'm going to start at this end and introduce Terri Marti. Terri is a LOSS team member, and you're going to be hearing about the LOSS team, LOSS. Dave will be telling you more about that. And CHE, here at CHE, we were pleased to be one of the original funders of that project. And so to see it here and the work that it's doing, probably 10 years later, is certainly a pleasure for us. But Terri is an original member of the LOSS team. She served all the way back to the beginning. She has a bachelor's and a master's degree from UNL, and she recently retired after 39 years as a special education teacher in the Lincoln Public Schools and other districts as well. So thank you for that. She is a founder and current board member of Families Inspiring Families, a nonprofit with a mission to help families who have a child with a behavioral health challenge. And she is the survivor of her father's suicide when she was 22. Michele Phillips. Welcome, Michele. She received her bachelor's in psychology from UNL and a master's. We have a highly educated group up here today. In clinical and drug and alcohol counseling from Doane. And in 2006, she and her husband, Daryl, lost their oldest son to suicide at the age of 13. Together, Daryl and Michele currently serve on the LOSS team as well. So thank you for that. Then Kimberley. Kimberley, I've known. She has served in the mental health field for a long time. I think, what did I read, 26 years? I think maybe it's in here. A long time. She recently became the clinical manager for the Bryan Medical Independence Center, and she has experience with both juvenile and adult populations, and she is she's also on the LOSS team, both as a survivor and a clinician. So we'll hear her story. And last but not least, Dave Miers. I've known Dave for a long time, worked with him in a number of areas, but he works as the Dr. Miers, Dr. Miers works as the, I got to get this right, Counseling and Program Development Manager for Mental Health Services at Bryan Medical Center, and manages the Bryan Counseling Center. Huge job in our community. He's been there 18 years. He co-chairs the Nebraska State Suicide Prevention Coalition and has published research both about family survivors of a child suicide. He was one of the creators, founders, visionaries of our LOSS team here locally. So thank you all for being here. We're very excited about this, and we'll look forward to hearing your stories.
Thank you, Lori. As you mentioned, I want to thank the Community Health Endowment for their support of the LOSS team. I wanted to give you a little bit of a background about what is LOSS and what is the LOSS team, to give you a little bit of foundation and framework for where we started and where we have come and the future of where we're going. Then I'm going to turn it over and have our LOSS team members share their personal stories of how suicide has impacted their life. Then we'll get into some more details about their work with the actual LOSS team. At the end, we'll open it up for questions to all of you. Historically, as Lori mentioned, the work of the State Suicide Prevention Coalition, that started back in 1999 when the Surgeon General at that time was David Satcher. He declared suicide a public health problem and said we need to do something as a nation, but all states needed to band together and individually address suicide prevention. At that time, the state of Nebraska, several of us went to Kansas City and met as a regional meeting, and that's at the point where the Nebraska State Suicide Prevention Coalition was formed. We've met monthly since that time, looking at suicide prevention in our state, and are looked at as the state's decision-making body in terms of suicide prevention efforts. How the LOSS team came a part of that is over the years with suicide prevention. There's different facets of suicide prevention. There's suicide awareness, making individuals aware that suicide is preventable. What are the warning signs, the risk factors? What is the methodology? How are we collecting the data? How are we looking at suicide? But also the prevention piece, and what are we doing in intervention as well. But the LOSS team is considered a post-vention model, and that's a very vital part of suicide prevention is post-vention. So if you read about active post-vention models, what you're going to see and what you're going to learn about is LOSS teams, and LOSS teams is the model of active post-vention. That's what we're here to talk about today. In 1997, Dr. Frank Campbell out of Baton Rouge, Louisiana, had this concept of LOSS and LOSS team, and he envisioned suicide survivors, those who have lost somebody themselves to suicide, being available to go immediately to the scene to help provide support to families immediately, to help them provide hope and healing and inspiration to help those families move forward with their grieving process after the death of a child or an adult or a loved one to suicide. And he worked in Baton Rouge and put that model together, and in 1997 that became active, and over the years he has become a national force behind helping LOSS teams get up and going. And that's why I want to thank the Community Health Endowment, because Dr. Belau, who's my the co-chair of the coalition and our clinical director for the LOSS team, we heard Dr. Campbell speak at a conference, and it was 10 years ago, talking about active post-vention in the LOSS team model, and we said, hey, that's really needed, and we need to bring that model to Nebraska. So we brought it back here to the state coalition, and we decided that we need to find a place to pilot the LOSS team model. So we said, well, we meet here in Lincoln. Let's pull folks together here in Lincoln and see if we can pilot it here in Lincoln, and approached the Community Health Endowment. They helped us with bringing Dr. Campbell here to Lincoln to help us with training and recruitment and pulling individuals together to put the LOSS team together. It really is a collaborative effort between many entities. It was Bryan Medical Center at the time, was the Community Mental Health Center, the Interchurch Ministries of Nebraska, the Lincoln Police Department, Fire and Rescue, the police chaplains, the county attorney's office. A lot of individuals came together when we pulled folks together and said this is a model that we want to bring to Lincoln, and had overwhelming support. That was back 10 years ago, and worked very closely with the Lincoln Police Department, and today there's what we call a standard operating procedure. So when there is a death by suicide here in Lincoln, Lancaster, in Lancaster County as well, but within Lincoln, the police department then notifies the police chaplain. The police chaplain then talks to the family and lets them know about the LOSS team, and gives them information about the team, asks if they're open to have a team member come out, or a team come out and meet with them. And at that time, we have a coordinator who's on call at all times. The chaplain will call that coordinator, and that coordinator will go out and pull the team together, and that team will go out and provide support to the family. So that's just a little bit of the foundation, the history of where the loss team started and where it is today. But we started, as a pilot here in Lincoln, and where we're going in the future with loss is that we envision it to be across the state, and the state of Nebraska received a 5-year grant called the Garrett Lee Smith Grant, which is through the Substance Abuse and Mental Health Administration, and we built into that grant having a loss team in each of the 6 behavioral health regions in Nebraska. So the loss team in Lincoln is serving as a model, and we're working with the Omaha metro area. We have a team that has started in Kearney, working with Norfolk, across the state. So we've taken the model and trying to spread it across Nebraska. We've also hosted the first and second national loss team conferences here in Lincoln. That was 5 years ago, and then the last 2 years we moved that to Columbus, Ohio, and then this year it's going to be in the state of Texas. So that just gives you a picture of how we took that idea and have grown it and helped not only Lincoln but hopefully our state, and then across the nation. Loss team is a team of generally 3 team members that are 2 individuals who've lost someone in their lives to suicide, as well as a clinician. So it's a team of 3 that go out and provide resources to families. There's no script. They go out and share their personal experience of suicide and are there to provide support and listening to families, and then provide resources that are available in our community to help families. And then we provide ongoing support after that as well. Team members go through training. They work with our clinical director, Dr. Bilau, go through an interview process, go through training, and then go through a process to become members of the loss team. Following each call, they do reach out to Dr. Bilau and they do a debriefing to talk about their experience on the call, any things that we need to, any next steps we might need to take. The clinician is there not only for the family to just be there as a supportive individual, but there for our team members as well. And we'll get more into depth in terms of how that process works here in a second. What I would like to do is to turn it over to our team. I would like to have each team member just tell us how suicide has impacted their life personally. And start with Kimberley.
As she said, I'm Kimberley Mundil. I've been with the loss team since we started. The first time I experienced a suicide close to me, I was driving down South Street and a very good friend of mine called and told me that her son had committed suicide. At that time, that was prior to the loss team, and so all I could think was, oh my God, how can I help or what can I do? And the loss team has been very helpful, and I wish that would have been around for her, because we went through some difficult times. She went through some very difficult times, and trying to figure out how to help her navigate that. Some of the information that Dave may share later is that when there's a suicide, traditionally it's about 4 years before somebody actually seeks out some sort of help. And I watched my friend through 4 years and then some of really stopping her life as a result of her son's suicide. And so when I heard about the training, I was like, I want to go. And I think at that point, the loss team didn't even really know much about it, but really wanted to be a part of that. Since that time, I've had a cousin commit suicide, and another friend of mine, her son committed suicide. And it's been really helpful to have some idea of what resources are out there, what help is available, not only for me, but also for the people that are impacted by the suicide, because the suicide has a huge ripple effect. It's not just the mother, the father, the cousin, the child. It's a community impact when someone commits suicide. And the best thing about the Lost Team is that we are introducing people to those resources before their own personal life has ended. They become survivors, they become stronger, and they don't stop living like I had to watch my friend do. So briefly, that's kind of where I'm coming from in terms of my involvement in the Lost Team.
My own personal story, I'm Michele Phillips, and my own personal story is that on July 19th of 2006, I was at work, and it was in the evening, and I worked second shift, and I got a call from my husband saying that our son was gone. And I asked him, "What do you mean gone? Go find him." And he said, "No, Michele, you don't understand. Ryan is dead." And Ryan was only 13 years old, and I couldn't comprehend that. That made no sense to me for a 13-year-old. And I said, "What are you talking about?" And he said it again, and I dropped the phone and I screamed, and "What are you talking about?" And I didn't know that 13-year-olds could die, especially at their own hands. I left work and I went to meet my husband at the scene at where Ryan had completed suicide. And it was full. I remember it being full of people, and it was very chaotic. There was the police department was there, and the fire and rescue department was there, and there were a bunch of onlookers there. And I just remember trying to make sense out of nonsense. And it was very chaotic. And I couldn't understand how a 13-year-old could die. The Lost Team did not exist back then. The police officers tried as hard as they knew how at that time to work with us, but it was evident that they didn't know how to handle us either. They were very professional with the scene and with how to work with Ryan and with the body and with the scene and with the evidence and everything. They were extremely professional and competent. But they treated us like porcelain dolls. They thought we were going to break. They didn't know how to talk to us or anything. And so we felt like porcelain dolls. We felt like we were going to break. No one came up and told us that we were going to be okay, which is what we needed. And so that was our experience.
Hi, I'm Terri Marti again, and as Lori said, I've lost my father to suicide in 1976. And he was only 42 at the time, and as she said, I was 22. And I was notified by the phone as well. My uncle called me and said, "Terri, this is your Uncle Don Marti. Your father shot himself today." And I did the same thing. I screamed and dropped the phone. It was a summer day, it was June. I remember that incident, and then from that point on, there's a lot of snapshots right afterwards. I've blotted out most of the memories. But at that time, I had just finished my first year of teaching. Like I said, it was summer, I was doing summer school, married, and he died just 3 days before Father's Day. My father, I believe, had done some real planning on it. He had purchased the gun the day before he died. Early that morning that he did die, he left home. I have 3 younger siblings, and my two youngest ones were living with him. So he left home before they got up. They had no idea where he was for that day at all. They were 15 and 17 at the time. Then he went to the Villager Motel, which is now a big empty lot, and got a room. He laid out 3 suicide notes, one to his father, my grandfather, one to his then wife, and one to my siblings and myself. He took off his class ring from UNL, he took off his Rolex watch, and he took off his glasses, and then he died. And like I said, this was 1976. You didn't say the word suicide. I know he'd had treatment for alcoholism. Again, you didn't talk about that a whole lot. I know he was very an emotional person, and I don't know if he was bipolar or if he had some other mental illness going on. But again, I was 22. I was off in my own world. Don't know that. But again, there was nobody there, short of my husband at the time, and my grandfather, who was not the emotional type, to help get me through that. Some of the long-term effects, though, I've learned is 2 years after my father died, I got a divorce from my husband. I kind of realized what I was in was not what I wanted to do. So that was one of the first things fallout from the suicide, is I changed a lot as a person. I felt like I needed to do more in helping parent my children, my siblings. I then kind of just floundered around for a while. It took me about 2 to 3 years to find some place that I could openly talk about my father's death. I would go to my friends at work. No, they don't want to hear about it. Don't want to do that. I actually couldn't find help even at my church. I dropped out of the church because nobody would sit down and listen to me there. And within family and friends, everybody said, no, we don't want to do it. So as a consequence, I finally found a place of Al-Anon because I knew my dad had been an alcoholic. They were willing to listen to me, and I did learn a little bit more about how and what some of his thought processes might have been. So here we are, 78, 79, floundering around. I did remarry, but I know that when my father died at 42, when I turned 41, I started going, oh my God, I am the same age almost my dad was. How could he have done this? How am I supposed to live past that? And darn near destroyed that marriage. Luckily we didn't destroy it, and we're still married. Another funny thing that happened along this process is that my children are adopted, and my father died on June 17th. And when our third child came to us for adoption, guess what was his birthday? June 17th. Another one of those twilight kind of moments in this process of dealing with my father's death and the long-term fallout. It still has impacted my siblings and myself still today. I watched all 3 of my siblings go through some other kind of strange occurrences around the time they turned 42 as well. It's not a topic of conversation among the 4 of us, which I wish it would be, but they are still stuck in the era of being 15 and 17 and 20, even this 38, 39 years later. They are not real comfortable with me doing this, talking publicly about it. But when I saw the newspaper article in 2007 in the Journal-Star saying the lost team is coming, I was all over it. I called immediately to the phone number. I probably talked to the person for a half an hour just spilling my guts about how much I was so excited because nobody would talk to me, blah, 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 long term. And I've learned extremely amount of what I went through and how I can help some other people not do that. But that's my short story. Thank you.
Well, thank you for sharing your stories. A couple things that three of you had mentioned, I think is very important to point out, is that, as I mentioned earlier, suicide postvention is prevention, and individuals who lose somebody close to them to suicide, that is a risk factor for suicide, is if you have somebody close to you who has died by suicide. So by reaching out and providing support and resources and getting folks connected is very important. There's a lot of research out there about connectedness, how the more connected we can build connections in our community, in our schools, in our families, in many facets of life, the more connected we are, the less likely it is that we're going to act out towards others or towards ourselves. And the LOSS team is there to help build those connections and to help start those conversations. Kimberley had mentioned, the research that's been done on the LOSS teams is that, prior to the LOSS teams, and the research that's been done shows that families who lose somebody close to them to suicide and don't have somebody who has themselves lost somebody to suicide come out and talk to them, like the LOSS team, they wait upwards to 5 years or more on average before reaching out for support. And with the LOSS team being there and providing that support, families are now reaching out within about 39 days is the average. So 5 years to 39 days is a pretty drastic change, and it makes a significant impact in the lives of those that the LOSS team does touch. So what I would like our LOSS team members to do is to, you've kind of alluded to this a little bit about how you found the LOSS team, but how has the LOSS team impacted you personally, and then how do you see when you reach out to families the impact it has on them by sharing your story with them?
The LOSS team is a family. We really are. We're about 20-some people now, but we're really a family. And when we go out on these calls, we go in and greet the family, and they don't really know what to expect. And every LOSS call is different. But the thing that I think is key, and what I've seen with the suicides that I've been connected with prior to the LOSS team, is this sense of hopelessness. And I think a huge piece of what happens when we walk through a family's door and meet with them is that we tell them that there is life to live still, and that there is hope. And while this may be the darkest hour in their life, that it will get better. And the thing that really kind of motivates me to keep doing the LOSS team is that usually before we leave, we've had some laughs with that family. And that's really hard to do when you're facing a suicide and you're trying to connect the dots in your head to make sense of it. And I think that's very powerful. The losses I've had since becoming a member of the LOSS team, the 2 suicides, all 3 of them have been very, very different responses by family, very different situations, very different support resources. But there's still that common theme of trying to understand how someone you love and you care about could decide to take their own life. And going out on these calls, we don't have an answer for these families. They quite often ask, why? We don't have an answer for why, and we tell them that. But we do try to get them through to accept that it doesn't mean that it's their time to stop living because their family member made this decision. And that, wherever their family member was in making this decision, it was their decision, and it was not something that they need to take responsibility or blame or accountability for. And I think that's a really powerful thing to share with these families because, as a mom, you think that you're there to protect and take care of your children, and when you have a child commit suicide, you really look at yourself and you can't take that on. And so I think really empowering these families to take care of each other and support each other and take care of themselves is huge impact that we have with the LOSS team.
Well, I found the LOSS team kind of by I found the Nebraska State Suicide Prevention Coalition shortly after Ryan passed away, because I wanted to be active and proactive very shortly after he passed away. I felt very helpless when he passed away, and like Kimberley said, I did take on, as a mom, what happened with Ryan, and I did take on his suicide. which is common, not necessary, but common in families. And so I wanted to become proactive, and so I searched out the Nebraska State Suicide Prevention Coalition, and I started going to their monthly meetings. And this was during the time when they were talking about bringing the LOST team to Lincoln. And so that's how I discovered the LOST team. How the LOST team has impacted me is knowing that I never had to take that on, and being able to reach out to other families and telling them our story, my story. We have had a couple of instances when there have been other children who we've lost to suicide, and being able to reach out to that mom and hold her hand and say, I lost my child too, has been the most powerful connection. And to let that mom know that you're not alone, the way that I felt when I lost Ryan has been the most powerful connection. And I can go home after that visit and I can say, I've done something today. I have made my day worth it today. I have helped another fellow human being today. That is what the LOST team has done for me.
When I think back to the visits I've done as a LOST team member, as Kimberley alluded, none of them are the same. They're all different. And when we walk in, we're strangers. And this family has invited us in the middle of their major shock and grief. And you go in immediately and say, my name's Terri. I have lost my father. I am sorry for you having to go through this, but I have been through it. We're here to help. And like she said, we do crying sometimes, and we do laugh. We tell stories. We share insights with each other of these are some things you might be dealing with in the future. This is how I navigated that journey, such as a holiday. How do you handle Christmas? How do you handle Thanksgiving? How do you handle some family dinners with one call out? And it's just a flow. And we're usually there maybe an hour. And the one unique thing is usually we get a hug when we leave. And you can see the family stress come down. You can see them physically calm down because we know what they're experiencing. We've been through it, so we can share that with them. And Michele says we know we've touched some lives. One of the most powerful things that happened to me when I was a LOST team member is early in this process, there was a death near Hickman that we went out to of a father who had died and had 4 children. And the oldest was 17, down through grade school. And we sat and talked with the mom and the grandmother and the children. And over in the corner was the 17-year-old on her phone the whole time. Didn't say a word. Didn't say a word. And I was there with one who'd lost her son, and I believe you too were. I don't know if you were there. So the 3 of us were talking, and we had it was a good call out. And as we got up to leave, the girl reached out and took my arm, and she said, "Can I ask you a question?" She hadn't said word one for the whole visit. And I dropped down, and I said, "Sure." And she asked me, "So were you ever ashamed or embarrassed by what your father did?" Wow. And I said, "Yeah, for a while I was." It's not easy to say that your dad died by a gun, himself. But at the same time, I said, I want you to know that your father always loved you. You had nothing to do with this. Please understand that. It was nothing you did or didn't do. And like Michele said that night, I went home and I went, this is why I'm doing this. This is why I was put here at this time and place, to help other people go through that.
Well, we've talked a little bit about language and that there's no script for the LOST team. And Kimberley mentioned the question why. That's a question that comes up from families is, why did this happen? The question why. And when will I stop asking the question why? And Dr. Campbell said something back 10 years ago that always has kind of stuck with me, and I think with some of our members, is that, it's okay to ask why. That we tell families that it's okay to continue to ask that question, because one day you're going to wake up and you're going to say, hey, I didn't ask the question why today. That we're there to provide support to help individuals know who to contact and who to reach out. But I know that sometimes many of us have been touched by suicide in different ways. But could you talk a little bit about we talked a little bit in our trainings about language and when we approach a family, what are some things that if others here listening and they're reaching out to provide support to families or somebody that they're close to, what's a way to approach someone that you're concerned about?
When we walk in, we typically say, we're so sorry for your loss. And one of the things we really avoid saying, we share with them that we've experienced this, we've walked through this process. We don't say that we know how you feel, because we don't. The way I felt with each of the suicides I experienced, it was different because my relationship with those individuals was different. And, we don't know what their relationship, just because they're married doesn't mean that they're still in love with each other. So, we say we're sorry for your loss, and what we try to do is we usually ask questions about the person they've lost, because the other thing is a lot of times these family members are the ones that found their loved one, however they committed suicide. And that image is pretty significant in their head. And so a lot of times we ask them about their relationship with that person, not that we're prying into how they get along, but just, what was it like? And we start asking, what did they enjoy doing, or what's something funny, that they shared. And we start trying to get them to talk about the person and trying to move past that image that they may have in their head of how they found their loved one. We also tell them that lots of times people say really stupid things. And it's not that they're trying to be mean or hurtful or that they're stupid, it's that they don't know. And we also tell them that sometimes people won't say anything because they don't know what to say, and rather than say something offensive or hurtful, they just don't say anything. And that doesn't mean that they don't care or that they don't want to be helpful. It's that they don't know how. So we also, we were talking about language, and there is no script. There are some things we try to avoid saying, like, I know how you feel. At the same time, we try and prepare them that people are going to say things and use phrases that may not be helpful to them, but it's done out of caring and kindness, and to try and be open. And we just encourage them to talk.
Mm-hmm. One thing that I remember that stands out to me is one time on a call out, we had a large family that we were working with, and we were talking with a brother and a sister and a mom, and we were talking with them about how the dad had passed away and how each of them had a different relationship with the dad. How the sister was, the daughter was the only daughter, and she was the joy of his eye, and she was his little princess. And the son was the one that they always worked on cars together, and they went to car shows, and they had that kind of relationship. And the mom, they still had a really good, loving relationship with each other, and they were all going to miss him dearly. And I tried to tell them, even though you all love him and you're all going to miss him dearly, you all had different relationships with him. You're all going to miss him in different ways. That's the kind of language that I try and talk with them about. Is it's not a competition about who's going to miss him more or how you're going to miss him. You each had a different relationship with him. Someone might miss him on a different day for a different reason and in a different way. Those are the kind of things that I try and talk with them about. And also, like Kimberley said, specifically that people might come up and in their best intentions to try and say something to comfort you, and it might come across in the most ridiculous way. I remember when we lost Ryan, we lost Ryan in a cluster in my family. We had lost 3 people in a very short period of time in my family. We lost Ryan, and then we lost my father-in-law, and then we lost my mom all together in a very short period of time. And someone came up to me and said, well, you should feel honored that you lost Ryan because he went with your mom. Mm-hmm. That Ryan chose to go with your mom. And I really wanted to sit back and slap that person. And I'm sure that from their point of view, they were trying to help me. I'm sure they were, but it came across as the most stupid thing to say. And so people in their good intentions have really dumb things to say, and so we try and prepare them for that.
One of the things I focus on is I work a lot with the children at first, children in the family, because I know what it's like to lose that parent. But I also tell the other family members that to take care of themselves, to not be ashamed of saying, I can't do this today. You know, and to be, if they are needing someone to listen to them, please to go up and say, could you just listen to me? You know, sometimes people will come up and say, what can we do? Let them know. I need you just to sit and listen. Don't talk, just sit and listen to me. Cry with me if you want, but just sit and listen. But again, to take care of yourself. And you will, as Dave says, quit eventually asking that question, why, every 5 minutes of your day. I still don't know the answer to that one myself. But as that progresses, you will then, I also encourage them to keep talking about their family member. They're still part of your life, and they always will be. I mean, I had a real good time learning about Husker football with my dad, and all these years later, I'm thinking of him when I'm sitting in that stadium, and what a good time we had together. And so that I want them to give that permission that they're physically gone, and you're not able to carry on a two-way relationship, but continue to have that one and talk about the good memories. And then you can talk about some of the stupid things people did and have some good laughs over it. But continue having that member be part of your family, and that's okay. And mainly just take care of themselves, because if they are parenting other children, the wife can't take care of her children until she's taking care of herself, and ask for help. The big one.
One other thing I wanted to mention is that we've also been on a learning curve with the loss team of going into different culture situations.
Oh, yes.
Terri and I were on one call that we met with the immediate family in a back bedroom. However, the living room and kitchen, every piece of furniture in the basement and the garage, every piece of furniture had somebody sitting on it, and then there were people lined up along the walls in chairs and things. And it was amazing to see that culture support of that family, but also in talking with the family, thankfully we had somebody who had worked with the family there so that we could be culturally sensitive to their beliefs about death and suicide.
We also needed the translation, too.
Yes.
They did not speak much English.
We also met with, we've had a couple of suicides where the family has been Native American, and we have a member on our team who is Native American, and she's really helped us, because those are calls where a lot of times you go out and you do more sitting and not talking, as opposed to a call out where you're doing a lot of interacting with the family. The two of those call outs that I was on, it was a much more kind of passive sitting and listening and being at peace, and just very different. And we need to be conscious and respectful of their beliefs about death, because we all have our own beliefs too. And religion we don't bring our religious faith into the calls, but sometimes if the family wants us to, we will pray with them if that's something they want or something like that. And we had one call out. It was kind of fun. It was a really good call out, and at the end, one of the sons said, "Well, I thought you were going to come pray with us." And we said, "Well, if that's what you want, we can, but that's not what we're about." And it was just really neat to see them supporting each other and starting to laugh, and like Terri said, that stress level just coming down, and figuring out how to breathe again.
I have a couple points about training and different things as we've grown through the years with the LOST team, and I'm going to share a few additional pieces about the team, then we'll open it up for some questions from you, for our team members. The LOST team, as I mentioned, when I say a team of 3, we have about 20 active members of the LOST team, of individuals that fill that are the clinician role, suicide survivor role, lost somebody themselves to suicide, and individuals who fit both roles, who are clinicians but also survivors. And when we have a call out, then we have somebody that's the coordinator, that does not go on the call outs, but they take the phone. We have a cell phone that the coordinator carries, and it's a monthly rotation, and we have the team of 3 that's on call, and then the coordinator receives that call from the chaplain, and then calls the active members and says, "Okay, let's meet." We do have a call out. They work with the family to schedule a time to go out and provide the call out, and typically the team will meet together and go out together and leave together and then do that debriefing with Dr. Belau. One thing that we do is, even though we have the active team, if there's death by suicide that, let's say, for instance, involves a child, and if we have our active team doesn't have anybody on the team that themselves have lost a child, if we do have somebody that's on the roster that has lost a child, we may reach out to them and say, could you be a part of this call out? Or try to find somebody that has a similar experience that can be there to provide that connection with families. I mentioned we reach out to Lincoln, Lancaster County. We've also been working with Saline County and Seward County, and in fact, since we started 10 years ago, we've reached out to other counties across the state and other entities to help, and our team is more than willing to help out as needed, depending on our resources. It is a volunteer group. Everybody is a volunteer as a part of the team. We meet on a monthly basis at Bryan Medical Center on Saturday mornings we do our monthly meeting. And then Dr. Belau does some training, and Kimberley was mentioning some of the cultural diversity training. We do a lot of different trainings, and then that's also the time when we have new team members come in, then they go through a different training process and some of the same training as well. So it is a very cohesive team. It is a process to where it's again a volunteer group. We work with the Interchurch Ministries of Nebraska. We have a coordinator through the federal grant that we have that's helping with coordination of loss and then helping with loss development across the state. With the national loss conferences that I mentioned, that enables us to connect and reach out to other loss teams to find out some of their processes, and if we come across situations that we need to get feedback from, and vice versa, it has been a great resource for us.
Just one other thing. When you're on the loss team, you do volunteer to be 24/7. We do have the right to say no, but we were on call to go out, and I know all of us have had some of those. I've had 11 o'clock on a Sunday night call out that the family needed us. And I got home at 1, and I got up the next morning to teach school. It was a long day, but you commit to that. But at the same time, we do have the number of people that you can say, I'm having my own crisis, or I have an illness or something, or like can't move around very much right now. But we do have some of that flexibility. But you do volunteer to go out to meet with the family when they need you.
And the members work together, and as you mentioned, if somebody's busy and can't be there, then the other team members step up and fill in, and that works out very well. Great communication and great teamwork in terms of our team, and that's what we're helping others and training and getting others, getting teams up and going across the state. I do want to allow some time for questions, so I want to, I think Lori has a microphone, and anybody have any questions for our team members?
Well, first of all, I want to say thank you to all of you. I know you want to join me in thanking them for sharing their story. Thank you, guys. I'm curious to know how many of you knew about the Lost Team before you came? Some of you, but not all of you. And so I think one of the things is raising awareness about the work you do, and the availability of your services is great. So you said someone in the back had a question? Kim.
One other thing, I mentioned that we pair, we have our team members go out, and if we have team members that have had a similar experience, one thing that we're working on as far as our Lost Team growth is we are working with our military here in Nebraska, and we'll be working to develop a Lost Team component that'll be part of the Lost Team if there's a member of our military that loses their life to suicide.
Well, first of all, thank you for the excellent presentation. It was very informative. If you'll allow me, I have two questions. My first one is, Dave, you mentioned that the police chaplain first approaches the family about, would you like a visit from the Lost Team? I'm just curious, do the majority of the families say yes? Or what would be the approximate percentage of yes versus no on that?
That's a great question. Our model here in Lincoln is, as I mentioned, is the active post-intervention model. I want to back up for a second. I'm glad you brought that up. Is that the original model that was developed in Baton Rouge, the active post-intervention model, when they activate their team, they go directly. They don't ask the family. They go, and they're there to provide support. We go as quickly as possible, but I would say probably about 90% of families will say yes. Please give them our information. Maybe a little bit higher than that. That the chaplain will call and provide the information to our coordinator. But then when we call the family, then I would say it's probably about 90% will say yes. Let's schedule a time. Other times families will say, well, we're not quite ready for somebody to come out. Can you call us in a couple days, or can you call back tomorrow? So then we'll continue to call and check in with the family to see if they're ready for us to come out and meet with them.
Thank you. Then my second question is, then once you make that first visit with the family, is there any ongoing contact between team members and the family?
As Dave mentioned, we're teams of 3, and one of us is always designated the team leader. And that's just because we're the ones that walk in first and kind of monitor how things are going. But we do always ask the family, would you like us to keep in touch with you? And again, most of them say yes, they're okay with that. And the team leader then will be responsible for keeping contact, a couple weeks out, a couple months, stretch it out over the next year. And it could be a phone call, card, thinking of you card. I've gone out to another family to the home again for a second visit on a follow-up call. So again, it's what the family needs and where they need to be at. But yes, we do encourage follow-up. And some of the nice things that has happened is we here in Lincoln has started a lost walk. And last year we started seeing some of our families that we had contact with on call-outs coming to the walk. And so they're now feeling comfortable of coming out in public and doing that with us. So yes, we do encourage follow-up.
Other questions?
I'm sorry, if the family does not want to call out at that time, and what we'll do is we'll send a packet to the family. We do have a nice folder that says Lost Team on the front, and inside we refer folks to the Ray of Hope support group here in town, which is a support group specifically for those who've lost somebody to suicide. Morning Hope, several other grief resources and a pack of information about grieving after the loss, specifically to suicide. So we'll mail that packet out to the family. But we, as Terri mentioned, there's families that we've reached out to, a long time ago that we're still connecting with, and just have that connection with that family and providing ongoing support.
The chaplain actually now leaves the family with a brief card about the lost team. So some of those families that say no initially will get a call a month or two later saying, hey, I had this happen, and is this a possibility? So some of those, the 10% that maybe initially say no, do call us later, and we're always willing to respond, whether it's happened yesterday or a year ago, if they want it.
Sometimes there's in the situations too, I want to mention this, that we mentioned the police chaplain calls us, but sometimes there's situations where an individual may die by suicide, but they live in another state, but the family's here in Lincoln, and people have heard of the lost team and say, well, I think, would you reach out to that family? So there's the handouts that I gave you on the bottom there is information for Jennifer Fry, who's the coordinator of our through Interchurch Ministries of the Coalition. You can contact Jennifer, you can contact myself, Dr. Bilau, really any of our team members. They will reach out to us, and then we'll make a decision in terms of, can we get the information and reach out to that family. So there's other ways to activate the team. It doesn't have to, most of the time it's through the chaplaincy, but there's times where we'll receive a call that family, may not have heard of the team, and again, the situation is a little bit different. Lancaster County, it's the sheriff that's reaching out to us, so there's other ways to reach out to us.
Other questions?
Thank you all for your sharing and your work in this important area. I know individuals who have lost children, and it's there's nothing worse probably, but not always by suicide. Sometimes accidental death, help, whatever, and it seems to be. I don't know how you measure it or how you differ in the impact on it on people, but what's available for those families who have lost a child but not by suicide?
Morning Hope provides support for families and children. Morning Hope is a service that provides, they'll work with like the siblings and things like that, and they're very helpful in working with the loss of a child.
Again, thank you so much for sharing your stories. And it sounds like there is a relatively good process for debriefing once you go on those call-outs, but understanding that you all are human, how much of an impact does the call-out then have on you and reflecting back on your own experiences? And I guess my question would be, what do you do? Does this bring up all of those old feelings, or is it sort of one of those things that after a period of time you sort of go into the service mode and don't necessarily reflect back on your own experiences?
I do both. I mean, during the call out, I'll cry. And it's like I started to get a little teary-eyed here just earlier. That emotion doesn't go away. You learn to live with it and cope with it, but it pops back up even all these years later. And I think that's good that I can share that with a family, that it's okay to still feel that way. When I got first into this, I remember going home and just being exhausted. I was a great call out. I'd feel really good about it, and then I'd go home and just collapse and go to bed. It's like 7 o'clock at night, I'm in bed. And it took me a couple times to kind of feel like that was my way of handling the stress. I don't do that quite as much, but there's times when I do that. And if there's a bad memory that comes up, that's why we talk with Dawn. That's why we have the Dave and the backups to help us through that. At least for me, that's what we've done.
And each other.
Oh yeah, like she said, we do process a lot in the car as we're driving back home. Yeah. Thanks.
You mentioned initially that you work closely with the Lincoln Police Department, and that usually your first call out is from, did you say the chaplain or the chair? Okay. I guess my question is, I'm a first responder family, so my husband is a police officer. And I would say suicide is probably the number one thing that causes him the most frustration and anxiety. And I'm curious, as a first responder family, but also as with that relationship, those individuals that are first responders on the scene along with the family, what kind of, do you do any work with them? Is there a support system for them? I'm also a big fan of what you're doing with the military, so thank you for that. But I am curious because they also sense that loss and that can add that connection to that family. So is there something that's available for them?
There's a lot of different trainings in terms of EMS. I recently went out and presented to an EMS conference about that exact topic, about taking care of yourself. Because first responders, firefighters, police officers, are on the scene of a lot of different situations that are very traumatic and face a lot of different things. And there are support systems within the different entities. I'm not sure about the police department as far as their connection with, but I believe they can still connect with the critical incident stress management program that we have here in the state. I know when I was involved more with that, we reached out a lot to firefighters and different places to where if there is a situation that comes up or a difficult call for those individuals, then they can activate the critical incident stress management team for the state, and they will come out and help debrief with individuals. Other entities, have, and I don't know the policy at the police department, but if they have like an employee assistance program or different support services available, it's important that they utilize those. I know that through the different, like the fire, I don't the Lincoln Police, but our Lincoln Fire Department, a lot of fire stations have like peer support groups, peer support services within their departments, and are encouraged to reach out to their peers to debrief and to talk about what they've experienced.
We, not necessarily with first responders, but I know at one point when I was on call, I was team leader and got a call, and we actually went and met with coworkers of an individual because they requested a call out. So that is something that we've done if it's been requested.
I guess my question is, how many people have you responded to? What are the numbers like?
That's a great question. I would say we, our average is about one a month. If you take through a year, maybe more than that. It's a couple call-outs a month, but sometimes we'll go a couple. The goal is to have no call-outs, but we'll go several months with no reports. But then sometimes we'll have 2 or 3 at a relatively short amount of time.
We've had 4 for the month of March that are deaths by suicide that I'm still working on with the families to arrange the call out. So, yeah.
Well, thank you so much again. Oh, we have one more question and then we'll wrap it up.
You talked about how the different call-outs are different, and you also talked about the why question. How often do you find that the family, after the fact now, the family has a way of, oh, I should have seen this, I should have seen this, I should have seen this, that they believe they know what the reason was, but they just don't know what they could have done, so that, do you answer those kind of things or work with them on those kinds of things as well?
That happens. Sometimes it's on the first call out, sometimes it's on the follow up, but there will be that hindsight of, oh, I missed this, I didn't see this, and we really tell them, those may have been some things that were communicated, but if a person has made a decision to commit suicide, if you have that hindsight, you may have intervened at this moment, but they would have found another moment. So you just can't take that on as I should have, would have, could have.
I really feel like that's the survivor, the person who's saying that's a way of self-blame And I agree with Kimberly. That's just too much for someone to take on, the self-blame. That's really sad.
Well, one of the things I've learned about Lincoln, and since I've lived here the past few decades, has been the willingness of people who've gone through specific circumstances to talk about them and then use that experience to help other people. And it's some of the most, just successful programs that I've seen. And this isn't just one example of how people are using their stories to really impact the community for the better. And so again, thank you very much for being here, for sharing your stories, and thank you all for being here. And don't forget that we have 2 more series left. Go to our website at chelincoln.org to register for those. Again, thank you so much.